today we are going to talk about managing pain-related issues in aging women. To share with us more on this topic, we're glad to have with us here today Dr. Jerry Chen. Dr. Chen is a visiting consultant orthopedic surgeon from Thomson Specialists. Thank you for being here with us today, Dr. Chen.
Thank you, Kelly.
So Dr. Chen, I realize that for us ladies, especially myself, as we age, our muscles and our bone tend to experience some changes. For instance, for the same activity that I used to do when I was younger, I felt perfectly fine after that. But nowadays, I get muscle aches, I get back aches. So how does aging affect our bone and muscle health?
As we get on a little bit of age, our muscles are more stiff. We are less flexible than we are younger. So for the same intensity, the same amount of activity that we used to do, we may get muscle pull, muscle sprain, or muscle inflammation, we call tendinitis. And of course, this actually results in aches and pain that we usually feel. Fortunately, most muscle ache will resolve by themselves. Usually we can do a couple of days of rest, or we can pop 1 or 2 painkillers, and they should go away with some good rest. What is worrying will be if the pain gets worse and worse, or if the pain persists beyond 6 to 8 weeks. Then we may be managing a condition more serious than a simple muscle sprain. In such situation, it will be good to seek medical consult to evaluate what could be the cause of the pain.
So Dr. Chen, you mentioned there could be more serious conditions if the pain persists. What are some examples of these conditions that we have to take note of?
In the middle age, from 50 plus onwards, sometimes we are more worried about aging, degeneration of the joint, which we call osteoarthritis. So osteoarthritis of the knee usually affects female more than male in a 7:3 ratio.
So Dr. Chen, what are the signs and symptoms of osteoarthritis and how do we detect it?
Usually osteoarthritis presents itself with pain and stiffness. The pain is classically on and off pain. That's to say, if we walk more, we climb more stairs, we travel and aggravate the knee more, then we have pain. But after a few days of rest, the pain goes away. How we know it's getting worse is when the pain frequency gets more and more frequent, or the intensity of the pain with each episode get more and more pain. Stiffness, of course, is a later symptoms of the knee itself, where there's more bone spur growing and then we lose our range of motion. We can no longer fully straighten or bend our knee.
So what are the treatment options?
Generally, when we reach middle age to elderly population, sometimes the pain, the arthritis will have onset. More common in our Asian population, we call it the O-shaped deformity, where actually the knee start to bend inwards. And in such situations, sometimes we can see the X-ray. In the X-ray, there are still joint space present. Sometimes we'll follow to preserve the knee. We try to save the torn meniscus, the worn out cartilage. But if the joint space has been reduced, signifying a more severe osteoarthritis, wear and tear of the knee, and in such situation, if they require surgery, usually it's more of a partial knee replacement or full knee replacement.
Let's say in the instance that I experience some pain, at what point should I be visiting a specialist like yourself, and what happens if I delay it?
If we have acute trauma or an acute injury, for example in skiing, in your sporting activity, that results in pain, especially unable to walk properly, affecting our gait, I think it will be a good time actually to seek a specialist's opinion. If we notice our family member who has always been walking slower and slower, it will be good to suggest to them to seek specialist's opinion to see what could be affecting their pain, their function. What we want to achieve is to be able to bring our patients back to their daily activity, to a very good function, to good quality of life.
So Dr. Chen, any final words of advice and tips to maintain good bone and muscle health for a good quality lifestyle?
I think it's very worthwhile to also maintain a healthy, active lifestyle. Simple things like walking daily in the morning in the park. Actually, it's very good to maintain the bone strength to reduce the risk of osteoporosis. 5 years after menopause, it will be good for female to actually do a bone mineral density scan to screen for osteoporosis, and if required, to start osteoporosis treatment, and this will prevent the risk of future fracture.
Thank you so much, Dr. Chen, for sharing so much useful insights and good tips and advice on how we can maintain good bone and muscle health. So to all of us out there, let's continue to maintain a good and healthy lifestyle and have good bone and muscle health. Thank you again, Dr. Chen.
Thank you, Kelly.